Welcome to this explainer. If you've ever found yourself standing completely paralyzed in the supplement aisle, just staring at a wall of bottles promising the quote-unquote perfect pregnancy, well, you are definitely not alone. It's totally overwhelming. But today, we're cutting right through all that marketing noise. We are going to look strictly at the clinical data to figure out exactly what your body actually needs. All right, here is our roadmap for today. We're covering the seafood debate, crucial vitamins, supporting nutrients, special conditions, and finally, preventing complications. Let's get right into it.
Starting off with Section 1, the seafood debate, looking at omega-3s and mercury.
So, you need those essential polyunsaturated fatty acids, right? The clinical guidelines are super clear here. Aim for 8 to 12 ounces of safe fish every single week. Think your basic canned light tuna, albacore, salmon. Fantastic, low-mercury choices. You get all those amazing, necessary brain-boosting benefits for the baby without the heavy metal risks. The general rule of thumb? Just absolutely steer clear of the big apex predators. Shark, swordfish, king mackerel? Yeah, skip those completely. But despite those clear guidelines, here's a totally wild statistic. A recent study showed pregnant people in the US are eating an average of just 0.44 ounces of seafood a day. I mean, that's practically nothing. And get this, literally 100% of the people in that study were eating less than the recommended 8 ounces a week. We are vastly under-consuming safe fish, which is kind of crazy considering it's one of the absolute most critical things for fetal neurodevelopment. Now, I know what you're probably thinking, hey, can't I just pop a fish oil pill and call it a day? Well, actually no, it's not quite that simple. Clinical trials on fish oil supplements are honestly pretty mixed when it comes to infant neurodevelopment. Some show benefit, while others show no sustained cognitive improvements at all. So clinicians strongly push a food-first approach here. You should really only rely on a DHA supplement if you physically can't access or just absolutely cannot tolerate eating real fish.
Moving right along to Section 2, crucial pregnancy vitamins, the real heavy hitters.
Okay, let's cut through the absolute alphabet soup of the vitamin aisle. We're zeroing in on the major players: iron, vitamin D, folate, and iodine. Every single one of these has a massive, highly specific benefit for you and the baby, and they really form the foundation of a healthy pregnancy. But pay close attention to those at-risk populations. Like if you happen to be vegan, or you're expecting twins, or maybe you have a malabsorptive disorder, hitting these daily targets isn't just important, it's absolutely critical.
Let's break this down a bit. First up, iron. Because your blood volume expands so dramatically, you need 27 milligrams a day just to stave off severe maternal anemia. And hey, if iron pills totally wreck your stomach, which, let's be real, they often do, here's a highly practical pro tip. Alternating your dose to every other day can actually save your GI tract while still being super effective. Then we have iodine. You need about 250 to 300 micrograms daily. Why is that non-negotiable? Because globally, iodine deficiency is literally the leading preventable cause of childhood developmental delay. You absolutely do not want to skimp on this.
All right, checking out vitamin D next. The daily target is 600 international units. But get this, up to half of pregnant people are still deficient even when they're taking supplements. It just goes to show why sticking to strict daily targets and using high-quality supplements is a huge deal. And folate, you probably already know it's famously crucial for closing the neural tube, requiring 400 to 800 micrograms. But remember, that crucial closure happens just 18 to 28 days after fertilization. By the time many people even realize they're pregnant, that window is already closing. So having it in your system early is an absolute must.
All right, on to Section 3, the supporting nutrients, where we prioritize diet over pills.
Okay, deep breath. You don't need a pill for literally everything. Nutrients like calcium, vitamin B12, choline, and vitamin K, they're more like the supporting cast. If you're eating a solid, balanced mix of dairy, leafy greens, and varied proteins, you're honestly probably nailing it. In fact, clinical guidelines literally say there's zero indication for routine blood screening for these unless you have known deficiencies or specific risk factors. So yeah, your plate is definitely more powerful than a pill here.
But there is one pretty awesome exception in this supporting cast: vitamin B6. It comes with a massive unique perk. The American College of Obstetricians and Gynecologists actually recommends targeted supplementation of 10 to 25 milligrams 3 times a day, specifically to manage that absolutely exhausting pregnancy, nausea, and vomiting. If you're constantly sick and struggling to keep food down, this highly targeted vitamin approach can be a total game changer for getting genuine, evidence-based relief.
Next up, Section 4, Diet and Special Conditions. focusing on customized care.
Now, if you've ever had a metabolic or bariatric surgery in the past, please listen up. You absolutely must avoid double dosing your supplements. Taking a standard prenatal right alongside a specialty bariatric vitamin is incredibly dangerous. You can end up with toxic levels of certain nutrients, especially the retinol form of vitamin A, which, if it gets too high, can actually cause severe birth defects. This right here is a perfect example of why you can't just rely on a standard one-size-fits-all approach.
So instead of just blindly doubling up on pills, you've got to customize based on your medical history. Got inflammatory bowel disease? You need a specific first trimester iron and B12 panel. On certain anti-seizure meds, you definitely need dedicated anemia screenings. Vegans have to watch their B12, vitamin D, and calcium like a hawk. And if you've had a prior pregnancy with a neural tube defect, your folic acid needs literally skyrocket to 4,000 micrograms daily. The whole point is to give your unique body exactly what it's missing. No more, no less.
And finally, Section 5, preventing pregnancy complications through targeted use.
Okay, let's talk defense. When we look at actively preventing dangerous complications, the data on an amino acid called L-arginine is just, wow, it's dramatic. It acts as a nitric oxide precursor, basically helping to keep those blood vessels wide open. In clinical trials, utilizing L-arginine dropped the relative risk of general preeclampsia down to 0.52. But the crazy part? It slashed the risk of severe preeclampsia all the way down to 0.23. That is a huge, tangible protective benefit for at-risk patients, and it totally showcases the power of a highly targeted nutritional intervention.
And we see that same kind of targeted defensive strategy with specific vitamins. But again, you have to use the exact right tool for the job. Randomized controlled trials show that vitamin D supplementation actually successfully reduces the risk of preeclampsia by helping regulate blood vessel formation. Awesome, right? But vitamin C? Well, extensive reviews of 29 different trials showed vitamin C supplements unfortunately give you absolutely zero protective benefit against preeclampsia. You literally can't just swallow a random antioxidant and hope for the best.
So what does this all mean? The big takeaway from this explainer is that clinical guidelines are practically screaming for personalized care over some generic one-size-fits-all, marketing-driven pill. You have a unique diet, a unique medical history, and entirely unique risks. So armed with everything we've just covered, I want to leave you with one very important question for your doctor at your next appointment. Is your supplement routine truly tailored to your specific body, or are you just guessing in the vitamin aisle? Thanks for learning with me today, and definitely take that question to your next clinic visit.